Hey, Dr. Chris here. How's everybody doing? Well, it looks like the world is slowly opening up again, and so we're excited about that. And I think everybody's tired of being home. All the patients that we've seen this week have kind of shared that same sentiment. So we're glad to have everybody back on board, and we're again up and running and going. And so we'd love to see you and get any questions have that you might be wondering about. So. One thing I wanted to tell you about is next week we do have Dr. Savi, who's the developer of the Root implant company and the implant itself, obviously, and he is going to come on May the 27th, which is a Wednesday, and we are going to have patients to be able to see him. I know that some of you have kind of been on the fence about whether you wanted to do this or not, and I think I'll give you just a little bit of education and maybe a little bit of a nudge to really take advantages if you possibly can. Now, I'm going to have to do this sort of old school here as far as showing you some stuff, but I'd really like to show you what the implants look like. It's kind of fascinating, and I hope I won't bore you with too much, but it's kind of interesting. The ones that he has are the ones that actually are one unit. In other words, they're all one thing, and then we put a tooth on top of it, and that's fairly unique for the Root implant. And there's a lot of advantages to doing it that way, just because you don't have any cement lines and places for bacteria to gather around the implant, so the chances of it being successful are really, really high. So that's an excellent choice. Another excellent choice is one called a Xeramex, and we have used both of these on different people. The Xeramex has certain qualities and characteristics that I like better, and it just depends on the person. Sometimes I'll even use two different kinds of implants in the same person, just because it's based on what is best in that particular case. So as you can see, these are all zirconias here. This does not have a top on it, so we have to put a top on it a little bit later, but it's not a big deal to do it that way. So anyway, just there's your 5-minute lesson today, or 5-second lesson today on zirconia implants. Zirconium is the name of the metal that the zirconia restorations are made of, and the implants are made of. Zirconium is a metal, like I said, but when it's sintered and oxidized, it will actually change a chemical structure, and so it ceases to become a metal anymore. And so it's really a cool material. We had one of them tested and recently for biocompatibility with one of our very sensitive patients, and the person testing it came back and said, I don't know what that stuff's made of, but it's really, really great. So anyway, look forward to seeing you again. 260-9000, give us a holler. Love to see you again, and we'll welcome you with open arms. Thanks. Bye.